Hey everyone, so in this video we're going to go through two shoulder isometric drills for better shoulders, okay, to facilitate more variability in the muscular and joint segmental interactions around the shoulder complex. So the video here on the left-hand side is going to represent a strategy where we're trying to delay humeral internal rotation during humeral flexion. And video 2 here is going to represent a strategy where we're trying to facilitate end-range humeral internal rotation that we need to be able to express that scapular external rotation to facilitate thoracic extension for end-range shoulder flexion. Okay, so in this strategy here, we're focusing on delaying that internal rotation, maintaining humeral extension as we flex the humerus, maintaining some level of thoracic flexion bias. And of course, from a muscular standpoint, we're facilitating a little bit more of a lengthening contraction through the latissimus dorsi. Okay. So the reason why we have the foam roller on the ground here is because when we have the foam roller on the ground, or the position of the hand is below the position of the shoulder, this allows us to delay the flexion of the humerus. So it allows us to put a little bit more emphasis on what kind of behavior the scapula, the rib cage, the humerus is expressing through that humeral flexion range. Okay, so one of the things that we need to do to be able to enable humeral flexion is to allow for the scapula to internally rotate, to bring the glenoid cavity, the socket of the scapula, into the sagittal plane. Okay, in order to be able to isolate, and again, I appreciate that you can't necessarily isolate that scapular movement, but if you wanted to try and drive or bias a little bit more independent scapular movement, we don't want the humerus to help it. So that's one of the reasons we are trying to maintain a humeral external rotation bias during humeral flexion here, because it puts a little bit more challenge on the scapula's ability to internally rotate on its own. Whereas if I was to internally rotate it very quickly, then that's going to help facilitate that internal rotation of the scapula. Okay, so if we have a scapula that's internally rotating with a humerus that's internally rotating, then both segments are moving in the same direction from a rotational standpoint. And we don't really have a huge amount of variability there from a kinematic standpoint, from a joint segmental standpoint, okay, between those two local segments. So if we wanted to try and facilitate more local variability, we want the humerus to express more external rotation, and then we can get some load into the triceps, into the humeral extensors here via the lat, for example, as we roll the foam roller away or just maintain this position. Okay, so all you're going to see here is an isometric strategy. You're not going to see a huge amount of dynamic movement, but we're just driving that load down to the fist, trying to maintain some thoracic flexion to try and facilitate that scapular protraction. But the key thing is trying to maintain that humeral external rotation. But the key thing to understand here is that we won't really be able to maintain that humeral external rotation through the full range. We need to eventually internally rotate the scapula. Internally rotate the humerus and externally rotate the scapula. So towards the end range of humeral flexion, that's when we need the humeral and scapular segment to express different rotational behaviors. Okay, so in this strategy here, where we have the bench at the same height as the shoulder, it allows us to bring the thoracic spine into a little bit more extension. Of course, we have the humerus in a little bit more flexion as well, whereas it'll be very difficult to then facilitate that scapular external rotation if we had the hand in this position down here, for example. So we have to change the height of the surface that we're actually putting the hand segment on. But what we want to try and do here is actually facilitate some internal rotation to facilitate internal rotation of the humerus, to help facilitate that external rotation of the scapula, which will help facilitate that thoracic extension. What we don't necessarily want is a really early extension of the spine, which sometimes you'll see in clients that can't really flex the humerus very well. Okay, they're using the spinal extension, or even more focused at the lumbar spine, to bring the humerus into an overhead position. But we want to try and make sure that upper limb has that capacity on its own without utilizing spinal extension. Okay. So again, another isometric strategy: get into the position, try and facilitate that internal rotation of the humerus in this position, and you'll see that drive a little bit more external rotation of the scapula here. We're building pressure down into the hand, but it's more so about what kind of proximal position are we facilitating as we get load through humeral extension here as well. In the previous video, we were getting some load into form extension and humeral extension. In this video here, there's more of a concentration of load through humeral extension, but as we express more of an internal rotation behavior at the humerus and an external rotation behavior at the scapula. Okay, so hopefully you see the two key differences there. We may use these two interventions with the same client depending on their unique limitations. In other clients, we may have to bias this strategy here. In other clients, we may have to bias this strategy here. Depends on what we're seeing during the objective assessment. Sometimes clients will be able to express good protraction capacity at the scapula, express good external rotation through those middle to later ranges, but they struggle to internally rotate the humerus and externally rotate the scapula towards that end range. Other clients may extend the spine far too quickly, so we may have to try and delay that motion at the humerus and the scapula by pre-positioning the spine into more of a flexed position. Okay, so again, these interventions may look simple when you're looking at them in a video, but it's really all about trying to apply them to the right client and in the right sequence, depending on the unique client's limitations.